Imagine being told that the one activity you've trusted for years may no longer be enough to protect your body after 60. Walking feels safe. It feels responsible. Doctors recommend it. Friends swear by it, and it's often the first thing people turn to as they age. But here's what most older adults are never told. From an orthopedic and surgical perspective, walking alone does not strengthen the muscles that actually keep you upright, protect your joints, or prevent falls. And in some cases, relying on it too much can quietly accelerate weakness. Here's what really happens after 60. Muscle mass declines, reaction speed slows, and joints become more dependent on muscular support. Walking moves the body forward, but it does very little to activate the deep, stabilizing muscles that protect your knees, hips, spine, and balance system. Surgeons see this every day. Patients who walk daily yet struggle to stand from a chair, climb stairs, or recover from a small misstep. The issue is not effort. It's the type of stimulus the body is receiving. Now, here's the part that surprises most people. Some of the most effective exercises for older adults don't require gyms, weights, or even getting down on the floor. They use something you already have in your home, a wall. Wall-based exercises allow you to activate powerful muscle groups, improve posture, and train balance in a controlled and joint-safe way. They remove fear, reduce impact, and create the kind of strength signals your body actually responds to after 60. You'll notice that when the body feels supported, it's willing to work harder. The wall provides feedback, stability, and alignment. It allows you to hold positions that engage muscles deeply without stressing the joints. This kind of controlled tension is exactly what aging muscles and joints need. Surgeons and physical therapists often use wall exercises in rehabilitation because they restore function without risk. The same principles apply to long-term health and independence. Another reason wall exercises outperform walking is posture. Walking with poor posture reinforces joint stress. Wall exercises naturally guide the spine, hips, and shoulders into better alignment. This alignment reduces pain, improves breathing, and makes everyday movement feel easier. When posture improves, balance improves. When balance improves, confidence returns. And confidence changes how you move throughout the day. These exercises also train what walking does not. They train the ability to push, stabilize, and hold strength. Standing up from a chair, climbing stairs, carrying groceries, catching yourself when you trip. These are the movements that determine independence after 60. Wall exercises target them directly, while walking often skips them entirely. In this video, you're going to learn 5 wall exercises that surgeons and rehabilitation specialists value because they rebuild strength where it matters most. Each one is safe, controlled, and suitable for older adults at different fitness levels. You don't need to rush. You don't need to push through pain. You only need to hold positions that teach your body how to support itself again. As you go through these exercises, imagine what it would feel like to move without hesitation, to stand with confidence, to trust your balance, to feel your legs, hips, and core working together instead of fighting against you. That's what these wall exercises are designed to restore. Walking is not the enemy, but after 60, it cannot be the foundation. Strength, stability, and control must come first. And sometimes the most powerful changes begin by standing still, leaning gently against a wall, and letting your body remember how to be strong. Imagine doing everything you were told was right after 60. You walk every day. You stay consistent. You make the effort, and yet over time, something feels off. Standing up takes longer. Turning feels less steady. A small stumble suddenly feels dangerous. From a surgical and orthopedic perspective, this pattern is extremely common, and it has very little to do with motivation. The issue is that walking by itself no longer protects the systems that keep the body safe and independent as it ages. After 60, the body changes in very specific ways. Muscle mass declines, especially in the legs, hips, and deep stabilizing muscles. Reaction speed slows. Joints become more dependent on muscular support to stay aligned and protected. Walking moves the body forward, but it places very little demand on muscle strength, balance reactions, or joint stabilization. The movement becomes familiar, predictable, and low challenge. The nervous system adapts to that low demand and stops treating walking as a strength-building activity. Surgeons see this disconnect all the time. Patients who walk daily but cannot stand up from a chair without using their hands. Patients who can walk long distances yet struggle with stairs, balance, or sudden changes in direction. This is not a contradiction, it's a result of specificity. The body adapts to exactly what it practices. Walking practices forward motion. It does not practice holding strength, controlling joints, or reacting to instability. Another critical issue is balance. Most falls do not happen during long walks. They happen at home. While turning, reaching, stepping sideways, or standing up too quickly. Walking rarely challenges balance in these ways. It does not train lateral stability. It does not train rapid correction when the body shifts unexpectedly. Over time, the nervous system loses confidence in these reactions because they are never practiced. When something unexpected happens, the body hesitates, and that hesitation is often enough to cause a fall. Walking also does very little to protect joints after 60. Joints rely on muscles to absorb force and guide movement. When muscles weaken, joints take on stress they were never meant to handle. Knees absorb more impact. Hips lose alignment. The lower back compensates. Walking does not restore the muscle strength needed to unload these joints. In some cases, walking with weak support can even reinforce poor mechanics, increasing discomfort over time. Posture plays a major role here as well. Many older adults walk with a slight forward lean, rounded shoulders, and reduced hip extension. This posture compresses the spine, restricts breathing, and increases joint stress. Walking in this posture does not correct it, it reinforces it. Over thousands of steps, the body learns that collapse is normal. That collapse sends a constant signal of vulnerability to the nervous system, increasing stress and reducing physical confidence. There is also a psychological component that is often overlooked. When walking becomes the only form of movement, the body becomes good at one thing and less capable at everything else. Standing from low surfaces feels risky. Stairs feel intimidating. Uneven ground creates hesitation. This hesitation changes how people move. Steps become smaller. Movements become guarded. Guarded movement reduces muscle activation, which leads to further weakness. It is a quiet cycle that many people don't realize they are in. From a surgeon's perspective, the goal after 60 is not just movement, it is resilience, the ability to support the body, control joints, and recover from small challenges. Walking alone does not build that resilience. It maintains circulation and cardiovascular health, which still matters, but it does not address the systems that determine whether a person can live independently without fear of falling. This is why relying on walking as the foundation of fitness after 60 often leads to frustration. People feel like they are doing the right thing, yet their bodies continue to feel weaker and less stable. The problem is not effort. The problem is that the stimulus no longer matches the body's needs. After 60, strength, balance, and joint protection must be trained deliberately. Walking can be part of the picture, but it cannot be the foundation anymore. What changes the equation after 60 is not effort, but safety and feedback. Aging bodies respond best when strength is built in an environment that feels controlled and predictable. This is where wall exercises become uniquely powerful. A wall is not just a surface, it's a stabilizing partner. It provides external support that allows the body to engage muscles deeply without fear of falling, losing balance, or stressing the joints. From a surgical and rehabilitation perspective, this combination is exactly what older adults need to rebuild strength safely. One of the biggest barriers to strength training after 60 is fear. Fear of pain, fear of injury, fear of falling. When the nervous system senses fear, it limits muscle activation. Even if someone is technically performing an exercise, the body holds back. Wall exercises remove that fear by offering constant contact and feedback. When you lean into a wall or press against it, your body knows where it is in space. That sense of security allows muscles to engage more fully and more honestly. Joint safety is another critical factor. Traditional exercises often require balance, coordination, or getting down to the floor. For many older adults, that alone is a reason to avoid them. Wall exercises keep the body upright and supported. The joints move in controlled ranges. There is no sudden loading, no momentum, and no unpredictable shifts. Surgeons favor this type of controlled loading because it strengthens muscles while protecting cartilage, ligaments, and bone. The wall also improves alignment automatically. When the back, hips, or shoulders make contact with a wall, posture begins to correct itself without forcing. The spine straightens. The pelvis finds a neutral position. The shoulders settle into better alignment. This matters because strength built in poor alignment often increases pain. Strength built in good alignment protects joints instead of stressing them. Another advantage is how wall exercises create meaningful resistance without weights. Pressing into a wall activates muscles isometrically, meaning they contract without moving. This type of contraction is extremely effective for older adults because it builds strength at the exact angles used in daily life. Standing up, pushing a door, stabilizing during a stumble. These actions all involve holding force, not fast movement. Wall exercises train this exact capacity. From a neurological standpoint, wall exercises improve body awareness. The wall provides tactile feedback that helps the brain understand position and pressure. This improves coordination and balance. The nervous system learns to trust the body again. That trust reduces hesitation, and reduced hesitation improves movement quality throughout the day. Wall exercises are also scalable. Someone can start with very gentle pressure and short holds, then gradually increase intensity by pressing harder or holding longer. There is no need to change equipment or learn complex techniques. This simplicity increases consistency, which is one of the most important factors in long-term strength maintenance after 60. Another overlooked benefit is how wall exercises reduce overall stress on the body. Because they are controlled and slow, they do not spike heart rate excessively or overwhelm the nervous system. This makes them suitable even for people dealing with joint pain, osteoporosis, or balance concerns. When the body is not overwhelmed, it adapts more effectively. Surgeons and physical therapists use wall-based movements early in rehabilitation for a reason. They restore strength without risk. They re-educate muscles to work together. And they rebuild confidence alongside physical capacity. Those same benefits apply outside of rehabilitation. For older adults who want to stay independent, wall exercises provide a safe pathway back to strength. When strength is built safely, the body responds. Muscles reawaken. Joints feel more supported, balance improves, confidence grows. This is why wall exercises often outperform walking after 60. Not because walking is bad, but because walking lacks the safety, feedback, and joint-friendly resistance that aging bodies need to truly get stronger again. One of the most overlooked reasons people continue to feel unstable or uncomfortable despite staying active after 60 is posture. Posture is not just about appearance. It determines how force moves through the body, how joints are loaded, and how the nervous system perceives safety. When posture is misaligned, even strong muscles cannot protect the joints properly. Walking with poor alignment quietly reinforces these problems. Wall exercises, on the other hand, correct them at their source. As the years pass, posture tends to change without people noticing. The head drifts forward. The shoulders round. The upper back stiffens. The hips lose extension. This shifts the body's center of gravity forward, forcing the knees, hips, and lower back to compensate. Walking in this posture increases stress on joints and reduces balance. Each step reinforces the same pattern. Over time, this becomes the body's default. Wall-based exercises interrupt this cycle by providing immediate alignment feedback. When the back, hips, or shoulders contact the wall, the body naturally organizes itself into a more efficient position. The spine lengthens, the pelvis settles, the rib cage stacks over the hips. This alignment reduces unnecessary strain and allows muscles to engage the way they were designed to. From a surgical perspective, alignment is everything. Joints last longer when force is distributed evenly. Pain decreases when muscles guide movement instead of joints absorbing impact. Wall exercises create the conditions for this by teaching the body how to hold itself correctly while under load. Strength built in good alignment protects joints. Strength built in poor alignment accelerates wear. Another key benefit of posture correction through wall exercises is breathing. Poor posture compresses the chest and limits diaphragm movement. This shallow breathing keeps the body in a mild stress response. Wall exercises encourage an upright chest position, allowing deeper, calmer breaths. Improved breathing lowers stress hormones and improves oxygen delivery to muscles and joints. This alone can change how the body feels during daily movement. Balance is also directly tied to posture. When the body's center of gravity is forward or uneven, balance reactions slow down. The brain struggles to predict where the body is in space. Wall exercises restore a centered posture, making balance corrections faster and more reliable. This is especially important for preventing falls that occur during turns, transitions, or sudden movements. You'll also notice that posture affects confidence. When posture improves, movement feels easier. People stop bracing before they move. They stop hesitating. This reduction in hesitation improves muscle activation and coordination. The body moves as a unit instead of in pieces. Walking becomes smoother not because of more steps, but because the body is finally aligned to support it. Another advantage of wall exercises is that they reinforce posture under static load. Holding positions against a wall teaches the body to maintain alignment without constant movement. This is critical because many falls and joint injuries happen during stillness or slow transitions, not during fast activity, standing, turning, reaching. These moments require the body to hold alignment, not generate speed. Wall exercises train this exact capacity. Over time, consistent wall-based posture work reshapes the body's default alignment. Upright posture becomes natural. Slouching becomes uncomfortable. This reduces chronic tension in the neck, shoulders, and lower back. Reduced tension lowers fatigue and pain, making movement more enjoyable and sustainable. Walking can then be layered on top of this improved alignment. When posture is corrected first, walking becomes safer and more effective. Steps feel lighter. Balance improves. Joint discomfort decreases. But without correcting posture, walking alone continues to reinforce the same compensations that led to instability in the first place. This is why posture-focused wall exercises are so highly valued in rehabilitation and surgical aftercare. They rebuild the foundation before adding movement. For older adults, this foundation is what makes the difference between simply staying active and truly staying independent. One of the biggest misunderstandings about staying active after 60 is the belief that movement alone equals functional strength. Walking keeps the body moving, but it does not train the specific actions that determine whether someone can live independently. Surgeons and rehabilitation specialists focus on function because function is what protects people in real life. Functional strength is the ability to hold, push, stabilize, and control the body during everyday tasks. Wall exercises target these exact abilities in a way walking simply does not. Think about the movements that matter most after 60. Standing up from a chair, holding yourself steady while reaching, pushing a door open, carrying groceries, catching your balance when you stumble. None of these movements involve steady forward motion. They require the body to generate force without momentum, often while remaining in one place. Walking skips this entirely. Wall exercises train it directly. When you press into a wall, your muscles engage isometrically. They produce force without movement. This is how muscles work during many daily tasks. When you stand up, your legs hold and push. When you stabilize yourself, your core and hips lock in. When you regain balance, muscles fire quickly to stop motion. Wall exercises recreate these demands in a controlled environment. Another key advantage is joint protection. Functional strength requires muscles to absorb force before it reaches the joints. When muscles are weak or poorly coordinated, joints take the load instead. This leads to pain, stiffness, and injury. Wall exercises strengthen muscles at joint-friendly angles, teaching them to support the body without stressing cartilage or ligaments. Surgeons favor this approach because it reduces wear while improving capacity. Wall exercises also improve coordination between muscle groups. Walking uses a repetitive pattern that requires little coordination once learned. Functional tasks require multiple muscles to work together at the same time. Wall-based holds teach the body to engage legs, hips, core, and upper body simultaneously. This coordination improves reaction speed, and movement efficiency, both critical for fall prevention. Balance training is another area where wall exercises excel. Many functional movements challenge balance while the body is stationary or moving slowly. Wall exercises allow you to train balance without the risk of falling. The wall acts as a safety net, letting you challenge stability while maintaining control. This builds confidence and improves balance reactions without fear. There is also a mental component to functional strength. When people feel physically capable, they move differently, they stop guarding their movements. They stop avoiding tasks. This mental shift increases muscle activation and improves movement quality. Walking alone often does not create this shift because it does not address the movements people fear most. Wall exercises do. Another important factor is adaptability. Functional strength requires the ability to hold strength at different joint angles. Walking uses a narrow range of motion. Wall exercises allow you to hold positions that mimic real life demands. Leaning, pushing, stabilizing, this prepares the body for unpredictable situations, which is where injuries often occur. Surgeons see the consequences when functional strength is missing. Patients who are active but cannot recover from minor challenges. Patients who fall not because they are inactive, but because their bodies cannot respond quickly enough. Wall exercises rebuild this missing layer of strength safely and progressively. When functional strength improves, everyday life changes. Standing feels easier, movements feel controlled, fear decreases, confidence returns. Walking becomes something the body does well because it is supported by strength, not because it is the only thing being practiced. This is why wall exercises often outperform walking after 60. They don't just move the body, they prepare it. They train the muscles and nervous system to handle real world demands. Walking can maintain movement, but wall exercises restore the capacity to live independently and respond safely to the unexpected. After 60, the order in which you train your body matters more than how much you move. Many people continue to walk first and hope strength and balance will follow. From a surgical perspective, that order is backward. Strength and stability must come before walking if the goal is to preserve independence. Without support and control, walking becomes a repeated stress rather than a protective activity. Wall exercises restore that missing support so that walking can actually serve its purpose again. When the body lacks strength and stability, every step requires compensation. The joints absorb more force. The muscles hesitate. Balance reactions slow down. Walking in this state reinforces insecurity rather than confidence. Over time, the nervous system adapts by making movement more cautious, steps shorten. The base of support widens. These changes feel protective, but they actually increase fall risk by reducing adaptability. Surgeons see this pattern frequently in patients who are active but unstable. Strength training changes how the body responds to movement. When muscles are strong and coordinated, joints move smoothly and predictably. Balance reactions happen automatically. The body trusts itself. Wall exercises are ideal for building this foundation because they allow strength to develop without risk. They teach the body how to hold itself together before adding motion. Stability is especially important for the hips, knees, and spine. These joints form the framework that supports walking. If they are unstable, walking places repetitive stress on vulnerable structures. Wall exercises reinforce alignment and muscle engagement in these areas, allowing the joints to be guided rather than overloaded. This reduces pain and stiffness, making walking more comfortable and sustainable. Another reason strength must come first is confidence. Fear of falling is one of the strongest predictors of reduced activity after 60. When people feel unstable, they move less. When they move less, they weaken further. Wall exercises break this cycle by providing a safe environment to rebuild strength. As confidence returns, movement becomes more natural. Walking feels like an extension of strength rather than a test of balance. There is also a neurological benefit to prioritizing strength and stability. The nervous system learns through repetition. When it repeatedly experiences controlled strength holds, it updates its expectations of what the body can handle. This improves reaction speed and coordination. Walking layered on top of this improved control becomes safer and more effective because the nervous system is prepared to respond. From a surgical standpoint, many injuries occur not during intense activity, but during routine movements when the body is unprepared. Standing up too quickly, turning awkwardly, slipping slightly. These moments require strength and stability, not endurance. Wall exercises train these exact qualities, reducing the likelihood that a small challenge turns into a serious injury. Walking still has value. It supports cardiovascular health, circulation, and mental well-being, but it should come after the body is strong enough to support it. When strength and stability are restored first, walking enhances health instead of exposing weakness. Steps feel lighter, balance improves, fatigue decreases. The body moves as a unit rather than a collection of compensations. Independence after 60 depends less on how far you can walk and more on how well you can control your body. Strength and stability determine whether you can stand up, catch yourself, and move confidently in your environment. Wall exercises rebuild these capacities in a way that respects aging joints and nervous systems. When the foundation is rebuilt, walking becomes what it was always meant to be, a tool for enjoyment, connection, and overall health, not a substitute for strength. This is why surgeons emphasize restoring support and control first, because independence is not preserved by motion alone. It is preserved by the ability to hold yourself steady, respond to challenges, and trust your body to do what it was designed to do.